Actually, I want you to be energetic, okay? And give a reaction to me, okay? Actually, I'm tired too. And I have to say, okay, for this reason, please be in coordination with me, okay? If you have any question, don't hesitate to ask me. Okay, let's start. Here, Shabab. Okay, in this slide, you can see the content of filtrate. What is filtrate? Filtra. What is filtra? Filtra is what is filtrate inside the Bowman's capsule. Okay, as I told you, it is protein free. Why? Because it separates based on the size and charge. Proteins cannot pass. Okay? Lacking of cellular elements. Yes. For this reason, we say plasma is filtered, not blood. Okay? Plasma is filtered is more correct than blood is filtered. Got it? Because blood cells cannot pass. The concentration of most salts and organic molecules are similar to the plasma. It is very important, dear Tola. Actually, Tola is for the men, just for boys, Tola, or all students.
For all.
And the Shabab means men, but not girls. Okay. Okay. I wanted to talk about what? What was that? Bowman's capsule, glomerular capillary. Okay, suppose that sodium concentration in blood is 142 milliequivalent per liter. Tell me please, how much is the concentration of sodium inside the Bowman's capsule?
140.
The concentrations are the same, okay? It doesn't mean, by filtration, it doesn't mean all sodium is filtered. All water is single, okay, is filtered. We don't have such a thing. This actually, substances move based on simple diffusion. It means we have the same concentration in blood and Bowman's capsule. Okay, here it is 142 milliequivalent per liter. Okay, suppose that potassium concentration is 4 milliequivalent per liter. What does it mean? It means in Bowman's capsule it is 4 milliequivalent per liter too. Okay, it's the basic principle of simple diffusion. Got it? For ions, for salts, actually, concentrations are the same, and for water, okay? But we have two exceptions. One is for calcium ions, and two is for fatty acid. Don't forget, amount of calcium and fatty acid in blood is more than Bowman's capsule. Why? The amount, not concentration. Okay, total amount of calcium and fatty acid in blood, glomerular capillary, is much more than Bowman's capsule. Why? Because actually both binds to albumin. Okay, half of calcium and most fatty acids are carried by albumin in the blood. They are not free to pass. Okay? Was it clear? There is attachment between calcium fatty acid with albumin. Albumin cannot pass. For this reason, these substances cannot pass. Got it? Total amount is not, actually is more in blood compared to woman's capsule, okay? Not concentration. Was it clear? Very good.
What about the charge? Calcium is positive charge. So have a differential.
Half of calcium is free.
Okay.
It can be passed. Half is in combination with albumin. Yes. For this reason, it cannot be passed. Okay. Regarding the fatty acid, most of the fatty acids are carried by albumin. Okay. Regarding the GFR, formula of GFR. GFR equals formula of GFR, Kf multiplied by net filtration pressure. What is Kf? Kf is filtration coefficient. Kf depends on permeability and surface area of glomerular capillary. When we say GFR, it means we are actually in glomerulus, okay, not in the tubules. For this reason, just we talk about glomerular capillary. Got it? Okay. Kf depends on permeability of glomerular capillary and surface area of glomerular capillary. Tell me please, do we have positive correlation between Kf and GFR or negative correlation?
Positive.
Positive, because we don't have denominator, okay? If it was in this way, for example, GFR, net filtration pressure divided by Kf, it has negative correlation, okay? It's not correct, okay? It was an example, okay? Here you can see there is positive correlation between Kf and GFR. It means when permeability increases, GFR increases. When surface area increases, GFR increases too. Got it?
Yes.
Okay. In renal diseases, in diabetes mellitus, in hypertension, because of destroying glomerular capillary, permeability and surface area decrease. For this reason, Kf decrease, GFR decreases. Got it?
Yes.
Very good. Regarding net filtration pressure, what is net filtration pressure? Net filtration pressure or delta P, okay? We are talking about GFR. It means we are in Bowman's capsule. It is Bowman's capsule, and suppose that it is blood, glomerular capillary. Okay. In glomerular capillary, blood pressure is 60 millimeter of mercury. Thank you. Blood pressure here is called another name of blood pressure. Here is hydrostatic pressure in glomerular capillary. Okay, it is the same as blood pressure. The first pressure is hydrostatic pressure in glomerular capillary. It is shown with PG. Okay. What is the direction of filtration? Filtration is from glomerular capillary toward Bowman's capsule or in the opposite direction.
The first one.
The first one in this way. Whatever. And actually each pressure which is in this direction, it means it favors. It is favoring pressure, okay? One pressure is in the opposite direction, it means it opposes filtration, okay? Tell me please, is it favoring or opposing? Blood pressure or hydrostatic pressure in glomerular capillary? Is it favoring or opposing? High blood pressure. What's the meaning of pressure? Pressure means exerting force to the area. Actually here we have 60 millimeter of mercury. It means we have 60 millimeter of mercury pressure against vascular wall. It is favoring. Got it? It favors filtration. Was it clear? Yes? Really? Okay. Pg is 60 millimeter of mercury in this direction from Bowman's capsule toward, from glomerular capillary toward Bowman's capsule. It is favored. Okay? The second one. The second pressure is here. Plasma is filtered and comes inside the Bowman's capsule. It means here we have fluid tube. This fluid exerts pressure to the membrane of epithelial cells of Bowman's capsule. But it is called hydrostatic. Pressure in Bowman's capsule. It is shown with P, B. B stands for Bowman's capsule. Okay, is it favoring or opposing?
Opposing.
It is opposing, thank you. It is opposing, and the amount is 18 millimeter of mercury in this direction from Bowman's capsule toward glomerular capillary. It is opposing. Got it? The third one is colloid. Be careful, please. Osmotic pressure in glomerular capillary. What does it mean? Colloid, osmotic pressure. Do you remember I told you proteins cannot be filtered?
Yes.
Okay. Proteins remain here, plasma is filtered. But proteins remain here and they become concentrated. Okay? Actually, they are actively osmotic particles because they cannot leave the capillary. At the same time, they pull water by osmosis toward the capillary, glomerular capillary. But it is called colloid. Osmotic pressure. Is it opposing or favoring? Very good, thank you. Because proteins are here, they want to pull water from Bowman's capsule toward glomerular capillary. Okay, it is opposing. And the amount of this pressure, it is shown with pi G. The G stands for glomerulus. Okay, amount is 32 millimeter of mercury, and it is opposing because it is in this direction, opposing. Buddy, no question. Let me complete it. The first one is colloid, osmotic pressure in Bowman's capsule. How much is
0?
zero? Under normal condition, there is no protein inside the Bowman's capsule. For this reason, this pressure is 0. This pressure, suppose that we have this pressure, is it opposing to filtration or favoring?
None of them, because it's zero.
Proteins. No, suppose that we have this pressure. Is it opposing? We have a lot of proteins here. Is it opposing or favoring?
Favoring.
It is favoring filtration because proteins are here. They want to pull water from capillary bed to toward inside the woman's capsule. It is favoring. Okay, but under normal condition, it is zero. It is shown with pi B, pi B, and under normal condition, it is zero, not 6. It is zero. Okay, zero. 0. And it is favoring, but it in this direction. Okay. Tell me please, we have just four pressures. Tell me please, how much is net filtration pressure?
10.
Net filtration pressure is favoring forces or pressures minus opposing. Calculate it please. Favorings are net filtration pressure equals favorings are favorings. PG, these are favoring, opposing, favoring. PG plus pi B minus opposing pressure. Opposing pressure are PB plus pi G. How much is it?
10.
Dear Banat. 10. 10 what? Tell me the unit. Unit is very important. 10 millimeter of mercury. 10 millimeter of mercury. Net filtration pressure between glomerular capillary and woman's capsule is 10 millimeter of mercury. Got it? No question, Jiyatullah. No question. May I wipe the board? This one. Okay. GFR is Kf multiplied by net filtration pressure or delta P. Okay. We don't have Kf. Why? Because we don't have access to glomerular capillary. In order to actually measure permeability and surface area. Okay, we don't have Kf. But we know GFR in a normal person is 125 milliliter per minute equals Kf. We don't know. About net filtration pressure is 10 millimeter of Kf will be 12.5 milliliter per minute per millimeter of mercury. Who can define Kf based on the unit? Who can? I'm guiding you. Define it based on the unit. You can see the unit here. Who is volunteer? Nobody.
The concentration and temperature at the same time?
Just based on this. Let's start from here. For each millimeter of mercury, pressure difference between glomerular capillary and woman's capsule in each minute 12.5 milliliter plasma is filtered. Got it?
Yes.
It is the meaning of Kf. It depends on permeability and surface area. Since we don't have access to capillary bed, glomerular capillary, we have to calculate it indirectly. Got it? No question. May I wipe the board? We can see actually in this figure. See the pressures, favoring pressures, opposing pressures. Okay. As I told you, there is a positive correlation between KF and GFR. When KF decreases, GFR decreases too. Okay? It is seen in renal diseases, diabetes mellitus, and hypertension because these diseases destroy glomerular capillary. The next one. Next item is increase in hydrostatic pressure in Bowman's capsule. Hydrostatic pressure in Bowman's capsule. What was that? Actually, PB is here. PB increases when we have accumulation of fluid here. When do we have accumulation of fluid here? When there is an obstruction, such as kidney stone. When there is a kidney stone, actually there is an obstruction. Fluid cannot flow inside the tubules, nephrons. Okay. For this reason, the pressure PB increases. Okay, there is a negative correlation between PB and GFR. When it increases, GFR decreases. Got it?
Yes.
Very good. PB is over. Regarding pi G, concentration of proteins inside the glomerular capillary. When pi G increases, is it favoring or opposing? Pi G. Proteins inside the blood.
The opposite.
Opposite pressure. Okay, it is actually, it opposes GFR. When pi G increases, GFR decreases. Okay. Under which conditions we have increasing pi G? One is when renal blood fluid decreases. What does it mean? Renal blood fluid decreases. How pi G increases? When renal blood fluid decreases, it means actually the flow rate is low. It means blood moves slowly inside the capillaries.
Exactly.
What happens? More plasma is filtered because plasma has more opportunity to be filtered. Got it?
Yes.
For this reason, proteins get more and more concentrated. And in this case, pi G increases. Okay, and GFR decreases. Got it?
Yes.
Very good. Another condition is when we have increased plasma proteins. When concentration of plasma proteins increases, it's obvious actually. Amount of protein is high and GFR decreases. Got it? No question? Really? Regarding PG. PG is the same as blood pressure. Do you remember hydrostatic pressure in glomerular capillary? There is a positive correlation between PG and GFR. Okay? When it decreases, GFR decreases. Okay? It changes as a result of three different conditions. One is when arterial pressure decreases. When systemic blood pressure decreases, PG decreases too. Why? Because PG is the same as blood pressure, systemic blood pressure. Got it? Actually, in the kidneys, This effect has minimal effect. Why? Because of autoregulation. We will talk about autoregulation phenomenon. Got it? Regarding the next one. Efferent outbound. Afferent arterial, capillaries, glomerular capillaries, efferent artery. Okay, suppose that resistance of efferent decreases. What does it mean? Decrease in resistance means vasoconstriction or vasodilation. Decrease in resistance means dilation or constriction.
Constriction.
Very dilation. When we have vasodilation, resistance decreases. Okay. Resistance of efferent decreases means we have dilation. Okay, now it is diameter of efferent arteriole. What happens? Don't forget any dilation, either in afferent or in efferent causes renal blood flow to increase. Don't forget, okay? Any constriction, either in afferent or efferent decreases blood flow. Got it? Here we have vasodilation. Renal blood flow increases. Renal plasma flow increases too. How about GFR? It increases. What does it mean? It means blood flows actually with higher speed because we have vasodilation. PG decreases. For this reason, GFR decreases. Got it? Also, we have increase in RPF and RPF. Got it? Pay attention to this one. Resistance of afferent arteriole increases. What does it mean? Vasoconstriction or vasodilation?
The resistance is increased, so we have conduction.
Actual resistance of afferent arteriole increases. It means vasoconstriction. Alright?
Yes.
Resistance increases. Renal blood flow increases or decreases? I told you, as a result of any constriction, renal blood flow decreases. RPF decreases, renal plasma flow. How about GFR? GFR decreases. Why? Because PG decreases. Got it? Got it? Okay, let's consider. One student had question. I think which one? One had question. It is the answer of your question. Okay. Here you can see afferent, efferent, and glomerulus. Okay. Here we have constriction in afferent arteriole. What happens? As a result of constriction, renal blood flow decreases. GFR decreases too. Why? Because PG decreases. But because the blood entry decreases to the glomerular capillary. Here you can see we have increase in actually vasoconstriction in efferent arteriole. Actually, this constriction doesn't allow blood to move freely. Okay, for this reason PG increases, GFR increases too. Since we have vasoconstriction, renal blood flow decreases. Here in this example, we have vasodilation in efferent arteriole. What happens? Vasodilation in one arteriole, either this one or this one, causes renal blood flow to increase. Okay? And blood move freely. PG decreases, GFR decreases too. Got it? And in the last one, we have vasodilation in afferent arteriole. RBF increases, PG increases. For this one, for this reason, GFR increases too. Okay. Do you remember renin? In the first slide, I told you renin is a hormone secreted by the kidneys, and I told you we will talk about that. Okay, what is renin? Renin is secreted, it is very important. It's secreted when blood volume decreases or blood pressure decreases. Okay, under these conditions, renin is secreted by the kidneys. What's the function of renin? Actually, in our plasma, in our blood, we have a protein which is called angiotensinogen. It is synthesized by liver and is added to the circulation. Renin affects on angiotensinogen and converts it to angiotensin 1. Angiotensin 1 under actually an enzyme which is called angiotensin converting enzyme ACE is converted to angiotensin 2. What's the function of angiotensin 2? I told you we have angiotensin 2 when blood volume and blood pressure decreases.
Okay, vasoconstriction and at the same time go to the other.
Actually, angiotensin is a vasoconstrictor in the kidney between afferent and efferent arteriole. It is vasoconstrictor for which one? For both? For afferent or for efferent? For efferent. It is vasoconstrictor for efferent arteriole. Efferent arteriole. Okay? What happens for efferent arteriole? It affects on efferent arteriole. Okay. Actually, I have to say, when efferent arterial constriction. Okay. Moderate effect, moderate, severe. When constriction of efferent arteriole, just efferent arteriole, when constriction is moderate, what happens? Actually, we have afferent arteriole is normal, efferent has vasoconstriction, moderate vasoconstriction. What happens? The blood comes inside, but it cannot leave capillary, glomerular capillary.
So that's
What happens? PG increases, GFR increases. Do you agree with me? Afferent arteriole is normal, okay? blood enters the glomerular capillary. We have vasoconstriction in efferent arteriole. What happens? Actually, PG increases, GFR increases. Suppose that now vasoconstriction is severe, no change in afferent, severe constriction in efferent. What happens? Blood cannot leave capillary. Blood remains here and plasma has more opportunity to be filtered. Proteins here becomes more and more concentrated. Increase in Ig is much more than increase in PG. Both increase. Okay, but increase in Ig becomes because proteins becomes more and more concentrated. Increase in PG is much more than increase in increase in Ig is much more than PG. For this reason, GFR it is opposing force. GFR decreases. I told you angiotensin II affects on efferent arteriole. In which degree? Is it moderate? Vasoconstriction is moderate or is severe?
Moderate.
Why? Why? Tell me the cause. Is it moderate or severe? You have to pay attention to these conditions. It is moderate, okay? Angiotensin II is a moderate vasoconstrictor. When blood volume decreases, blood pressure decreases, it wants to prevent decrease in GFR. Got it?
Yes.
Very good. It wants the kidneys continue filtration and excreting waste materials. Also, there is low blood volume and low blood pressure.
And if the kidney stop, that means we don't, or we can't absorption sodium or like that. So we can't say high renin. It is the moderator, the angiotensin.
Very good. Yes, that's right. No question? Nothing. I don't know what should I do. Here we have one of the most difficult, actually, concept in physiology at this time. Please be energetic, okay? There is no way.
Can we complete tomorrow?
Tomorrow is it?
Everyone is not you actually. It's not possible.
Tomorrow I have two lectures from the morning until this.
Tomorrow we have 2 lectures. Let me talk about macula densa, feedback, and then you can go. We will talk about autoregulation tomorrow. Buddy. Thank you. Thank you for your patience, okay? In advance. Okay? Be patient, please. Do you remember macula densa? Macula densa. I told you it is. Macula densa. Do you remember? The first part of the early distal tubule. Actually, it lies between afferent and efferent arteriole.
Yes.
Okay? I want to show you macula densa. Go back. We will talk about autoregulation tomorrow. It is the first part of early distal tubule, macula densa. Okay. As I told you, it lies between afferent and efferent arteriole. Afferent and efferent arterioles. Okay. it seems that it is a sensor. It senses something special, okay? And sends signal in order to control constriction and dilation of afferent and efferent arterioles. Got it?
Yes.
Suppose that arterial pressure decreases. Okay? What happens? When arterial pressure decreases, PG
Decreases.
decreases. Suppose that PG decreases. What's the effect of decreasing PG on GFR?
Also decreases.
GFR decreases too. But GFR decreases. Suppose that inside the Bowman's capsule we have less fluid, low amount of fluid. Okay? This fluid moves slowly, okay, because it is low amount. It moves slowly, and transporters in proximal tubules and loop of Henle have enough opportunity to reabsorb everything they want. Why? Because fluid moves slowly. Got it? Got it? No
Yes.
question? When this fluid reaches macula densa, the first part of distal tubule, what happens? Sodium chloride concentration in this fluid actually significantly decrease. Why? Because proximal tubule and loop of Henle cells in that segment actually have opportunity to reabsorb sodium and chloride more than normal. Got it?
Yes.
When fluid reaches macula densa, sodium chloride concentration is less. Macula densa is a sensor for sodium chloride concentration. It's considered to be a sensor. When it decreases, it activates two feedback mechanisms. One feedback mechanism to afferent arteriole, one to efferent arteriole, because it lies between afferent and efferent, okay? When it senses actually decrease in sodium chloride concentration, it activates two feedback mechanisms, one to afferent, one to efferent. Okay, what happens here? To afferent arteriole, it sends a signal to afferent arteriole and it decreases the resistance of afferent arteriole. What does it mean? It is constricted, or actually we have vasodilation. Afferent arteriolar resistance decreases. It means afferent arteriole diameter increases.
How relaxing.
We have vasodilation, okay, and it is glomerular capillary. We have vasodilation. What's the effect of this vasodilation? This vasodilation increases renal blood flow, increases PG, and increases GFR. Got it? More plasma, actually more volume is filtered because GFR and RBF increase. Okay. It sends another signal to efferent arteriole. In which way? Actually, cells in the walls of efferent arterioles and also afferent arteriole, named JG cells, juxtaglomerular cells on the walls of efferent and afferent, efferent and afferent you know what the effect of renin is. Renin causes angiotensin 2 to be produced, okay? Angiotensin 2, what was the effect of angiotensin 2? It had effect on efferent arteriole. Efferent arteriole resistance increases. As a result of this, actually mechanism, we have vasodilation of afferent, vasoconstriction in efferent arterioles. Both increases GFR, both increase PG. Got it? Also, arterial pressure is low. Got it? Very good. Let me show you. This figure. Actually, say juxtaglomerular apparatus. Juxtaglomerular apparatus is composed of juxtaglomerular apparatus is composed of macula densa cells, these cells, and juxtaglomerular cells on the walls of juxtaglomerular cells, these cells, on the walls of efferent and afferent arterioles. Got it? It seems that macula densa cells, after sensing decrease in sodium chloride concentration, release substance such as ATP. Transmitter here is ATP. These cells secrete ATP, okay? And it seems that ATP causes these cells, juxtaglomerular cells, to release renin. Got it?
What's the function of ATP? Why it's crazy ATP?
Actually, adenosine triphosphate. A lot of substances are suggested to be transmitter here. It seems that actually, Galton actually says that ATP is responsible for sending message. It is transmitter here. But some references actually say that norepinephrine might be a transmitter. Okay. It seems that ATP is transmitter in order to these cells secrete renin. On the other hand, these cells have a direct effect on afferent arteriole. Afferent arteriole diameter increases, these cells release renin, and renin causes vasoconstriction of efferent. Got it?
Yes.
And PG and GFR increase. No question. Okay. Actually, autoregulation is a bit difficult. Okay. Please be energetic for tomorrow. Okay. I really thank you. I have brought some questions in order to get familiar with the questions of the exam. But tomorrow we will review it. Don't you have any question? Okay, see you tomorrow, inshallah.
آره خیلی
اصلا من دیدم 8 ساعت دیگه با شما چک کردم چرا مثلا اسموز رو نذاشتم بعد
اصلا فردا همینطور بگیرم چون همون
فردا تا 3 ببین 2 تا با اینا دارم یکی با اونا دارم
بله
تا 3 بهتره زنده باشید
سلامت باشید.
دیدارتون
خیلی بگید انشاءالله.
زنده باش اینم خدمت شما
مرسی خیلی ممنون.
همه چیز
من استم من خواهم جلسه شما دارم نه من میدارم
咱们家里面